You are listening to the global network of podcasters dedicated to the pharmacy profession. Welcome to the Pharmacy Podcast Network.
Adverse drug reactions, or ADRs, are a serious issue in healthcare today. The pharmacist is the last line of defense to help prevent ADRs. A rising role of the pharmacist is the specialist who focuses on our children. Pediatric pharmacy ensures safe and effective drug use and optimal medication therapy outcomes in children up to 18 years of age. Currently, there are more than 1,450 board-certified pediatric pharmacy specialists, known as BPS. If you're interested in this expanding field of pharmacy, this podcast is for you. All right, everyone, let's give it up for our host.
Welcome to a special episode of the Pediatric Pharmacist Review, part of the Pharmacy Podcast Network. I'm the founder of the Pharmacy Podcast Network, and I'm so excited about today's episode. Been waiting for this to come out for our listeners to realize. And before I get started, I didn't realize that this is a statistic. It says 1 in 3 pediatric prescriptions contain an error. And I always think our children, our kids, our teens, who's overseeing the medication management for those, for our kids, for our people. And the partnerships that are being formed today look so different than what we knew 20 years ago when I entered pharmacy. And we do have a special announcement on this episode. HealthPartners is joining forces with Perfecting Peds to bring life-changing medication management to Minnesota's sickest children. And many of these young children covered by Medicaid and the Health Exchange manage complex medication regimes across multiple specialties. This partnership ensures that they get the safest, most effective treatments without the guesswork. I would like to say hello to our co-hosts, Dr. Jena Quinn and Lyle Miioduszewski. They're the co-hosts of Pediatric Pharmacist Review. Jena, it's so great to see you.
Thank you, Todd. Thanks for having us. Again, my name's Jena Quinn, CEO and co-founder of Perfecting Peds. I've been a pediatric pharmacist now for going on 14 years, and we're really excited to do a deep dive in what Perfecting Peds is, and more importantly, talk about one of our very, very special relationships with one of our first health plans and how that's evolved over the past year and a half, and how unique HealthPartners is to our success. So also, I always disclaim that I'm a mom of 3 because they keep me going every day. And I'm going to pass it over to Lyle, who's going to be my co-host for the day, to introduce himself. He's a fellow co-founder and president, and for lack of a better word, my partner in crime.
Thanks, Jena. Lyle Miioduszewski. Super excited for this one. Our relationship with HealthPartners has been pivotal for pediatric medication management in this country and setting an example of what can happen in really any geography. So excited to get in the conversation. I'm Lyle Miioduszewski, president, co-founder, Perfecting Peds, a registered nurse by background, also father of 3 kids that kind of keep us centered on the mission here. So excited to get into it and introduce our guests.
Okay, so our first guest that we have 2, Sarah and Nancy, again, both from HealthPartners and near and dear to our heart and our success. So I will first ask Nancy to introduce herself, and then Sarah do the same.
Thanks, Jena. Greetings, everybody. I'm Nancy Jorgensen. I'm a certified pharmacy technician. Been working in the pharmacy world for greater than 20 years. And just loving this portion of pharmacy and what it can do to increase the health of our members, and really love the opportunity to work with Perfecting Peds.
Thank you so much. And we'll talk about why we love HealthPartners so much a little bit more in detail. But first, I would love for Sarah to introduce herself as well.
Hi, my name is Sarah Groen. I am a clinical pharmacist by training. I was one of HealthPartners' original MTM pharmacists back when we started in 2006 and have more recently moved into the role of program manager for HealthPartners, so managing both our internal team of pharmacists as well as working with our network providers such as Perfecting Peds.
So I wanted to get us kicked off by share a little bit how we started Perfecting Peds, because Minnesota was strategically picked when I was asked where I wanted to start the company. So I'm going to just give it 1 second, or hopefully not more than a minute, background about why we started in Minnesota, and then pass it to Lyle to elaborate how we even got further into Minnesota with HealthPartners. So as you may or may not know, I started this company about 3.5 years ago. I was at, I looked crazy. I had a 6-week-old baby, but I took this 6-week-old baby probably fresh into me starting the company to a tubular sclerosis complex association meeting. So it was, they have one every 3 years. I was asked by a mutual friend whose son has tubular sclerosis, which is a very rare pediatric disease, which causes these little microangiofibromas to form everywhere. So it results in issues with their lungs, their kidneys, brain. So a lot of them have epilepsy and autism. And so when at that conference, I got to talking to some of the leaders of the association who said, hey, we would love to have a pediatric pharmacist virtually embedded into one of these tubular sclerosis clinics. Where do you want to start? And so I had to really put on, my business hat and think, well, what state in the U.S. will actually reimburse pharmacists for these services? And so from nothing more than sleuthing online, I could figure out that Minnesota was way more advanced in the pharmacy sector and had actual CBT codes, MTM codes that a pharmacist could bill for if they got credentialed with the health plan. So I started by getting credentialed with Minnesota Medicaid, HealthPartners, Blue Cross Blue Shield, and that just evolved in us virtually being embedded in the clinics. The providers gave us or referred to us patients, and we saw them, and we were able to bill. So that was kind of really the only avenue, which is kind of sad. And it was back 2023, and it's starting to become more the standard of care, but it is not in every state for pharmacists to be either reimbursed via CBT code or be recognized as providers and be able to bill mid-level codes. So that is still considered very, very new, but Minnesota has had these robust MTM programs that have been available since 2006, and Sarah and Nancy were part of those teams who started them. So I do fangirl frequently that because of them, they've given pharmacists a platform to have a lot more autonomy than we ever had in the past in the U.S. So that's how we started in Minnesota, but I'm going to pass it over to Lyle to fill in the story of when he jumped on how we got even further into Minnesota with HealthPartners.
Yeah, I think the uniqueness for Minnesota is that you can bill across all lines of business for, what's called medication therapy management in Minnesota. That's a different definition than we see in other parts of the country. And that's really what the serendipity here is with the story. We had a conversation with a quality leader at a different health plan that was in Minnesota, and we were talking about how the services of pharmacists are available to beneficiaries around the state and subscribers and members around the state across all lines of business. And that conversation went into, what are you guys doing for kids, right? So for a long time now, medication therapy management has been a requirement for Medicare populations. And you see that as a mandate, right? But when we started talking to people that were working these programs in Minnesota about what they did for kids, the answer was, we might have something in place today, but we don't have anything as robust as the specialty of a pediatric clinical pharmacist. Kind of, where have you been? And so that was a light bulb moment for us, where there was a pathway to getting reimbursed. There was a pathway to do this in the patient's home. We had previously been doing it in skilled nursing facilities exclusively. And there was a way for us to find the patients at a little bit better scale than working directly with provider offices that would be dependent on 1 and 2 referrals at a time. It was successful to prove the model that we had high clinical impact on patients that lived at home that had medical complexity and wide medication regimens, but getting those lives in front of us in large numbers needed to happen with those that were bearing the risk, had the infrastructure in place to reimburse for it, and had already proven out the return on investment of that work with previous populations. And so that led us to a conversation with Nancy, who heads up and liaises into all of the providers that provide medication therapy management in Minnesota. And we had a couple really great conversations, and the next thing you know, we were contracting as network providers and working with them on hundreds of lives at a time. So that's kind of the perspective from the Perfecting Peds side. I'd love to hear Nancy and Sarah talk about it from their side.
Yeah, I'll jump in there, Lyle, since it was you and I and Jena who had the first conversations here at Health Partners. So you reached out to us. I had nothing on my radar as far as pediatrics. We had a couple of providers in our network that saw children and see children today, but realized there was maybe a gap in there, that those children weren't being touched. They maybe were identified at some point, but weren't touched because of other competing priorities. So there was a gap that Perfecting Peds brought to our attention, and so we jumped on board with that. As a parent myself and having children to give medications to, I put myself in the place of a parent and looked at it like, wow, I mean, even me just giving acetaminophen to my child is like, oh my gosh, what do they weigh? How much should I give them? And then putting that in the perspective of a parent who has a child with complexities that are very difficult to manage, and collaborating with Perfecting Peds to help those parents just seemed like a natural fit. And so as our relationship, as the conversations went, as Lyle said, we did the contracting, and then all the things that come in between there, right? You have to think about what phone number, you have to think about how you're going to get the data over. There was a lot of pieces that had to be put together, and we worked on them weekly to get each piece and keep it moving forward. And here we are today. We have many great stories from our members that you'll hear maybe one of today. So we're just happy to have them.
And I think that Health Partners is in a unique position, being that we are a plan, but we are also a care group. And so we have the advantage to be able to see how the care affects our members, but also looking at a broader perspective. We have data that helps us identify our patients, our pediatric patients that are most likely to receive benefit from working with a pediatric pharmacist. It's one of those areas where when I practiced as a general MTM pharmacist, I knew a small piece of pediatric medicine, but just like we have oncology specialists for our cancer patients, and we have geriatric specialists for our older adults, having a team of pediatric pharmacists that has experience working specifically with this population and in some of these more rare conditions is incredibly valuable to our patients.
Thank you. And I would like to highlight, I feel like a lot of stuff in the pediatric population as it surrounds medication really is not talked about. And I don't know if it's a lack of awareness, or as Lyle will say, it's just a lack of dollars being funded there, because we tend to really hone in on the geriatric population. But I think there's more opportunities in the pediatric population, but I'm wildly biased. So as far as some stats that you may or may not know, I know Todd opened up the podcast saying 1 in 3. So to be an anal Annie, as I always am, it was 31% of pediatric prescriptions contain an error. And that was a robust study that came out of the United States Pharmacopoeia just recently in 2023. So that is very up-to-date findings. A lot of other things that people are unaware of is that 85% of pediatric medications are actually off-label. So just taking one drug class or disease state, for example, almost all outside of PPIs and H2s, there's a slew of high-risk medications that we use for GI motility, and not one of them is on label. So you have erythromycin, Reglan, Botanicol, all these high-risk drugs that we use with very little literature, and they're off-label. And so again, that's add on that you need a weight to dose any of them. That's like a double whammy for how much these kiddos are at risk for medication errors. And then one of my big life goals is to mandate the weights on scripts, but weights are not on scripts. So if you talk to our retail friends, they'll tell you, I don't have the pediatric training. It wasn't mandatory in pharmacy school. I also don't have the child's weight, so I blindly just fill whatever the pediatrician writes. And so that is really, after peeling back the layers as the founder, it was a glaring population health issue that needed to be solved for. And obviously, we're just scratching the surface on getting to hopefully decrease that 31% of medication errors. Additional things is that 13.8% of pediatric Medicaid beneficiaries are medically complex, so that's a pretty large N. And that complex pediatric patients drive upwards of 42% of hospitalizations. So those are all facts that a lot of people aren't aware of, but really is our why behind our mission. So I would also love to see and just tell you guys some of the various interventions that we've been able to categorize for the health plan. So we have been able to report back to Health Partners quarterly our findings. And with that, we've been able to show a trend in our interventions. So 17.7%, I'm just going to give the top three, our medication counseling, mean that we're educating, and I want Sarah to kind of elaborate how MTM in Minnesota is different. But we've been able to, a lot of parents don't know how they're giving the med or why they're giving the med, which is kind of wild. So if the parent doesn't understand why they're giving their med, it's a lot of times, I just had this yesterday, they're not going to give it. If they don't understand it. And then we were able to identify that a large group, about 10% of the time, there was adverse drug events, for example, an antipsychotic or an anti-epileptic, where there was no drug monitoring that was done in years, but it's a really high-risk drug. And then our third one was we were able to work with the health plan's care managers, which I would love to also have you guys talk about, liaison back to the health plan's care managers that they haven't had a slew of doctor's appointments, say it's a cardiologist, a neurologist, or even a dentist appointment in years. And we needed to get that back on the parents' radar and get them scheduled. So I think I would love, Sarah, especially being one of the first pharmacists in Minnesota to deploy what we call MTM, but that MTM's kind of become a four-letter word. So I love to hear how you guys differentiate your Health Partners MTM from the traditional Medicare MTM, because we really have learned so much from you by how comprehensive your services are.
So at Health Partners, we have our own internal team of MTM pharmacists, but also our network providers that engage with our patients. Our MTM providers develop longitudinal relationships with their patients. So these are patients that they're working with on an annual basis, or typically more frequently, where they're having follow-up, making sure that medications are effective, that they're safe, that they're affordable, and that patients have a good understanding of how the medications work. What's unique about the Health health plan side is that we are able to also engage with our network providers. We work with them to ensure that they're providing quality care. We work with our network providers in terms of providing incentives to network providers that are providing excellent care. We also hear a lot from our providers and our patients. So we are sending surveys, engagement surveys to our members. We're also talking with our providers on a routine basis and hearing a lot of positive benefits of providing MTM or comprehensive medication management to our patients.
One of the things that we were surprised with, and it relates back to one of the statistics that Jena gave at the top of the conversation, was the prevalence of complexity in Medicaid population, specifically for pediatrics. I think it's 13%. One of the things that we were surprised to see when we started working with you is that the people that we know we could help, and we work together to find them, they spanned all lines of business. And again, that was one of the attractive things about the state and specifically HealthPartners, is there was a reimbursement pathway for all those plans. But we see that complexity in commercial lives. We see that complexity in employer insured lives. We see that in commercial lives. Can you talk a little bit about how you're poised as HealthPartners to deploy that across all these other lines of business where we typically see it just in Medicare, and what went into the decision to do that, if you can remember back to when HealthPartners made that decision?
Yeah, so HealthPartners, when we were getting off the ground, we did a lot of work to really we had to show the value of our service. So beyond just our members being engaged is, what do we see? And so we have calculated ROIs based on past work. And based on that, we really found the value to be able to extend that to other lines of business. So when you look at the tools that we have medical claim data, pharmacy claim data, that we're really able to identify those patients and to attribute those patients to providers who are going to help them reach their healthcare goals.
That's amazing. I wish we could figure out a way to replicate that sentiment. I think when we start talking to other health plans around the country, it's immediately diverted to a Medicaid conversation, and geez, is it prevalent there? But it's interesting to see that this is, I'd say, a problem across any line of business that doesn't really differentiate if there's complexity or the level of risk or rare disease or rare drugs and things like that. It's been an interesting observation of ours, and then it's opened up the opportunity for us to try to find other populations and places that we didn't suspect. So it's interesting to hear.
Right, disease states know no financial boundaries, do they?
Yeah, it's that, and then also, Nancy, I think we suspected that sometimes it was going to be patients who were, maybe not Jena, but because I'm a nurse and not a pharmacist, I suspected it was going to be these newer high-cost drugs for the most part. But a lot of times we're finding that some of the most, I'll say, room for improvement is on patients who are on lower-cost drugs that just have terrible side effects, or if they're combined with certain drugs, the outcomes aren't favorable. And that's been an interesting finding too. Jena, do you want to talk about that a little bit?
Yeah, I would love to. So a lot of times, even people who are in the pharmacy space do just equate to, so you're going to take them off high cost drugs. So no, if anything, sometimes I might increase your pharmacy spend, but we're going to decrease your medical spend a ton. And so our studies pretty much say about 15% of the time we're taking off a drug, but I will say that there are times that we are adding on a more expensive drug to get better control of the disease state. But interestingly enough, some of the biggest offenders, I'll just give an example, is glycopyrrolate, right? So we have a child who's on the vent who is struggling with secretions. You absolutely have to dry the secretions up, right? There's no doubt about that. But a lot of times the dose is extremely high, and then they start adding on other anticholinergics. So it's just like the geriatric space. They're adding on cetirizine, they're adding on ipratropium, they're adding on antipsychotics. I mean, this is pretty much true for every patient. And so when that anticholinergic burden gets so high, then we have a patient now that's struggling with urinary retention, gastroparesis, and constipation. And so sometimes it takes, a pharmacist to get in there and say, hey, guys, can we trial Botox, which kind of sounds bizarre, but we actually inject it all around their salivary glands. And when you do the ROI, which the health plans want to, if you use Botox, you're able to peel off the glycopyrrolate. And a lot of times ipratropium is just like a med that's we use in the ER to keep them out of the hospital. If you start peeling off some of the meds and put on medications that have a better side effect profile, magical things happen. So they start spontaneously urinating. They're no longer spending all this time at the GI doctors. And sometimes, or a lot of times, our patients get so backed up, they have to go to the ER to get emergently disimpacted. And so all these things are really the root cause is just poor medication management. But a lot of people outside of pharmacists are looking at just the disease state as a new disease state and not thinking like what we're trained to think is like almost assume everything's from a medication. And that's very different given our training than the traditional providers like an MD, PA, MP, because they have so many other things on their plate that they have to think about. And so it just comes in and we're, just taking a sliver of what they're thinking about and thinking, how does this all go back to the meds that this child is or is not on? I would love to hear from, because Nancy and Lyle spent a lot of time on talking with our one patient who kind of had a similar experience, and we were actually able to publish this patient's story, which was really amazing. One of our patients and the mom in particular became a good friend of the Perfecting Peds team, just from how close we got with her. But I would love to hear Lyle to start off a little bit, elaborate on the story from a non-pharmacist perspective and Perfecting Peds staff. And then also to have Nancy jump in because she spent a lot of time actually personally talking to her as well.
Yeah, I can give the front end of it because I think people will find this interesting. When we are reaching out to families to try to enroll them in the service, it might not be any cost to them, but it's still a hard sale, right? We're asking typically the caregiver, family member, mom, dad, foster parent, whoever has medical decision-making authority over the patient to consent to something they've never heard of. They typically relate the word pharmacist to the person and only the person who's dispensing their medications. And unless they've really worked in acute care or have been exposed to clinical pharmacy, they might not know what it is. Mind you, if we're calling somebody whose child is in their teen years and they've had medical complexity, they've had a lot of different experiences, both good and bad, with different healthcare providers in their journey. And so we have a team of people who do cold outreach to these caregivers and ask them if they want to enroll and see a pediatric clinical pharmacist. It's a hard task. And it's often met with a little bit of resistance at first, and we've got to do a lot of educating on why it would be beneficial for them to come and see us. And so this story was no different than that. And the mother had 4 children that all had a very rare congenital condition, had spent years finding the care team that she felt comfortable with, that understood the disease that they all were born with. And letting somebody new onto the care team is not something that she does frequently. And so it took a little bit of a hook in this new concept to get her to enroll. And then just a matter of time of visiting, I think she was your patient or maybe Mary's, to see that there was some value here and some different ways of thinking, staying curious on her kids' cases and understanding that, hey, even something as simple as a medication that was left on the regimen from long ago and shouldn't have been there, or the timing of medication administrations wasn't ideal for the med combinations that she had for her kids. And so, long story short, and from my perspective on the front end, not only did we secure her trust and help the patient, but she ended up asking us to take care of the rest of her kids. And we see that a lot. We every day in our teams chat, our pharmacists are letting us know who had the most sibling referrals. And that, I think for you that are providing the care, like there's no higher honor than to have a parent say, I was hesitant to sign up for this service. You met with me on my child. It was so helpful that I want you to see the others. And then we get to go back to Nancy and Sarah and ask if we can pick up another patient by way of their own referral. So that's the front end. Right. I'll turn it over to the Health Partners team to talk about the experience from their side.
Yeah, so just to kind of piggyback on what you were saying, Lyle, is when we identified this member, the other siblings weren't identified. So Health Partners, from our perspective, those children weren't on our radar. And so when the mother got contacted by Perfecting Peds, to be fair, Perfecting Peds sold themselves. She gave them 15 minutes to prove themselves. Otherwise, she was done and wouldn't have anything to do with it again. So they gave their 15-minute spiel, and she was on board. And as Lyle said, it wasn't just one child. There were other children in the family that needed the same kind of care. So we were very proud of Perfecting Peds and how they engaged with this parent and the children. She jumped on board with Perfecting Peds. They, as a company, are really great people. They're not just great pharmacists, but they're really great people. And so they helped this family in more ways than one, not only just on their medications, but just on their personal life. And so these are the kind of providers we want in our network that align with our mission, vision, and values of caring for people in a very humane, loving way. And that's what Perfecting Peds does for our members.
Thank you, Nan.
I want to ask, we've written a story about this member. And so to share the clinical details, I don't know if that's the right answer, but I would love people who are listening just to hear a flavor of what a patient case might look like. And maybe we can reference a case or two from a different geography and just talk at that really high clinical case level.
Lyle's giving me the warning, don't get into your usual weeds, because this would be a whole hour if you let me just rip on great patient cases. So I'm going to try to keep it super high level. And it's hard, honestly. I'm going to just give two, but I could, again, go all day on this topic. So one of my, again, I have so many swimming through my head, but I'll use the one. A lot of our cases and patients that are attributed to us have behavioral health issues. And so, as someone who struggled with anxiety, OCD, and panic attacks, I think because I started at such a young age at 12 struggling with these things, like if there's a way for me to give back and help these adolescents, like that brings so much joy to my heart. So one patient in particular, he, again, without saying anything about him particularly, but he was actually living in a motel, a 19-year-old. And when he answered the call, he was intoxicated on substance. And I still think, why did he answer? I don't know, I was shocked. And so as that, he actually sat down and did an entire CMM session with me. And again, just being flabbergasted, I'm honored to be a part of this kid care. He's letting me in, and he's saying he needs help. And so we were able to get, with his consent, talk to his mom, and we were able to coordinate with the help of our care managers to get him into a crisis center, because he needed just at least 1 or 2 nights. And he eventually, from partnering with me and it took me almost 9 straight months of going through all of his past medications that he's been on, what has worked, what hasn't worked, doing a pharmacogenomics test and digging into his history to identify that the one medication he hadn't used that worked with his genetics was Abilify. And that was weight neutral. He always struggled. He was very self-conscious. Once he started gaining weight on the antipsychotics, he would take himself off. So we were able to get him on Abilify. Eventually, he consented to, because he did struggle with adherence, to go on IM Abilify. And he is now a productive, employed member of society, no longer on substances. And I check in with him once a month. And it is one of my favorite patients to work with. And again, being humane, like he's my buddy now. Like I'll call him, he's honest with me. We say, all right, have you been, have you used any substance? If he's vaped, he's going to tell me. We'll talk about, hey, Jen, I'm not ready. Can you give me another month to talk about your nicotine gum? But we have such a cool relationship. And I think that's like just being human and being honest that none of us are perfect. I'm here to help. I'm not here to judge is hopefully, and I know what all our providers in our org and our health partners do. So that's like a really cool patient win. The second
Jena,
one,
really quick before you go into like a different patient, Health Partners wrote an internal story, and they titled about a different patient that we worked on together, and they titled their story "A Personalized Pharmacist for Members." And what you're talking about and building that rapport, we just don't see in pharmacy today, and I think it's a huge miss. There is more knowledge and experience in this group of professionals that's untapped than any other healthcare professional in the country. And listening to you build that rapport and hear that it took you 9 months is reason and rationale for us to continue doing this every day. Like that was very impactful. And you wouldn't have got there without being able to see them continuously and have the continuity of care that you've had. I'd love to just quickly hear Health Partners' reaction to that.
When we get member stories back, we're always impressed with the efforts that we see our pharmacists going through to ensure the quality care, but also, like you're talking about, really understand the patients that they're working with. And I think you see the excellence in the care. I think you see the compassion in what these pharmacists are doing and providing care for patients who, like Jena was talking about, can be in somewhat difficult situations in life, and finding ways to work with those patients to help them achieve their goals. Such very personalized care that really benefits everybody.
And I will say what I neglected to say to Sarah and Nancy is like we commonly use the health plan and the crisis resources and your care managers, like our care managers liaison with your care managers. So I basically say to our care managers, hey, I have a patient that's, in a crisis, and they liaison with you guys. And so that's the beautiful thing is just sometimes like, waving the flag to say, hey, like we have somebody, and then working with all the various members of the health plan, including your care managers and our care managers correlate. That's how we got this kid to crisis and stable. So I feel like that's like a really important piece of this is that, we are social workers, and, I'm gonna very quickly start utilizing and ask our care managers to utilize your resources that you and your team have been amazing, the care managers at Health Partners. And sometimes it's just they're unaware. So letting them know, they're like jumping all over it and really helping us get this patient into a safe situation quickly, which is magical. And then the other cool thing, this other story, actually, I'm going to be so quick, I promise. 2, but the one's going to be so quick because Nancy, I'm sure she appreciates this, me calling her my mom, but that's nothing to do with better age. It's just because she's so maternal. She is like, right when I got this, I reached out to Nancy and it was like, Mom, look, oh my God. So I got a patient who I worked with for a full year and a half, and the mom, we tried again. We used PGX, looked at his mental health. He had really self-injurious, aggressive behavior, injurious to everyone else around him, and worked with the mom and him for a year and a half to finally, after 2 full years, able to hug her son. And she sent me a picture via my email, and I just lost it and immediately turned around and gave it, like, showed it, not the picture, but just said, Nancy, oh my God, how cool. Because again, we wouldn't be able to do this without her. And so that was a very heartwarming story. Can I tell one more epilepsy story and then I'll shut up? So one quick one. So one of refractory HealthPartners patients for epilepsy, and this wasn't me, this was one of our other clinicians, was able to work with the neurologist to start IV immune globulin, which is like, you start this in the most refractory of the refractory cases. We use almost every traditional anti-epileptic and figured out that the steroid bursts were the most effective to control the seizure clusters. And then we recommended doing IVIG because there was nothing else for this patient to use. We then were able to, after getting a few doses of IVIG at the hospital, actually coordinate between your care managers, the care managers and staff at a specialty pharmacy, and our staff to then transition it to sub-Q so the patient could start getting the immune globulin in the house. And the patient went from having hundreds of seizures today to maybe a couple a month. And so again, my last feel-good story, and then I'll be quiet because I could go for ages. But again, just like a sincere thank you for giving us this opportunity, guys.
Certainly great to have you on board in our pharmacy network, our MTM network. Great to work with you. And really, our clinicians have, I think Sarah can maybe speak to this a little bit more, but our clinicians have asked for Perfecting Peds to present to them, and wanting to refer their patients to Perfecting Peds. So kudos.
Yeah, I think that one of the highest compliments you can get as a healthcare professional is seeing the value of what you do, but also from someone who understands your work and sees what you do and sees the value. We had recently had a clinician reach out about an experience that they had with Perfecting Peds. They were contacted as an attributed member, so someone who felt that their child would be a good candidate for a medication review, and they themselves are a clinician. And so they participated in the visit and found such value from the visit that they contacted members of their own organization to set up a session where they could learn more about Perfecting Peds, because they saw the value themselves as both clinicians, but more importantly as parents for their child. So I think that speaks volumes to the work that you're doing.
Thank you, guys. I'm going to wrap this up because I could go all day, but thank you so much, Nancy, Sarah, my co-host, Lyle, for being here. And thank you, Todd, for giving us a platform for the pharmacist voice to be heard.
You've been listening to a special feature podcast presentation through pharmacists committed to patient health, committed to our partnerships with health partners, with organizations throughout the nation. If you'd like more information about partnering with a pediatric focused pharmacist, please go to perfectingpeds.com. Once again, that's perfecting, PEDS, perfectingpeds.com. Thank you for listening to the Pharmacy Podcast Network.
That's all for today's episode. Thanks for listening, and remember to subscribe on Apple Podcasts and leave us a review.